Uganda's first kidney transplant was performed in December 2023 at Mulago. In 2024, a team of Ugandan experts and a team from India performed 4 other transplants. Last week, surgeons at Mulago completed 4 other transplants with support from the team from the UK.
So we had a 16-year-old girl who's our first pediatric transplant, got a kidney from her 24-year-old brother. We had a 57-year-old gentleman who got a kidney from his 43-year-old brother, and that was our oldest recipient.
Dr. Frank Asimwe, a transplant surgeon at Mulago, says this time the team largely has been independent.
So we can comfortably say that the Ugandan team is slowly transiting to the point of being weaned. We don't want to be very presumptuous and think we are already stable on our feet. We still need some assistance. We are already planning another episode of transplant in October, November.
Initially, transplants were limited to patients aged between 18 and 40 years as medical teams sought to minimize risks and ensure good post-operative outcomes. However, these have since expanded to other age groups.
Subsequent transplants will be able to stretch our limits not just for age but other comorbidities or complications. So for example, right now we don't do diabetics. Hopefully going forward we shall be able to include some of these patients and show that an experience or experiment with more comorbid or more sick patients as we gain more and more experience going forward.
Most transplant recipients are patients undergoing dialysis or those about to start it, whose kidneys have been irreversibly damaged. Typically, patients receive kidneys from close relatives who meet key criteria such as compatible blood groups. Uganda continues to face a high demand for kidney transplants, with more than 400 patients currently on the waiting list. According to the Ministry of Health, kidney-related cases account for 40% of all patients referred abroad for medical treatment. According to the Ministry of Health, transplants abroad cost a minimum of $25,000, excluding additional expenses.
This development is exciting because it means people no longer have to travel abroad for a kidney transplant. Currently, government is footing the bills, but once they stop, how many Ugandans can afford this service?
Approximately, from our estimation, it is around 40 to 50 million per kidney transplant. But that is a rough estimate because there are other costs which are involved, like putting what they call immunosuppressive drugs after the kidney transplant.
Uganda is now looking into the possibility of launching a deceased donor transplant program, a move that remains controversial.
There are kidneys out there that are going down into graves, which could save lives, including the very people who are burying this person. But have this conversation and begin harvesting organs from people who have consented.
However, Uganda's Organ Cell Transplant Council, though established, is not yet operational due to lack of funding. The council is meant to regulate and oversee organ donation nationwide, among others. Its inactivity has limited the participation of private healthcare institutions in offering transplant services. The Ministry of Health has explained why Mulago is performing transplants despite the council not operational.
As a National Referral Hospital, a part of what we are doing is enshrined in their mandate. And it's the reason why whatever we are doing is on a pilot manner. And we are still teaching.
This financial year, Mulago National Referral Hospital plans to carry out 12 kidney transplants. So far, 4 have been carried out. NOBERT ATUKUNDA, NTV News.